Hi, I'm Dr. Landon Trost, an andrologist specializing in Peyronies disease and male infertility at the Mayo Clinic in Rochester, Minnesota. Now, I developed this series of videos in an attempt to optimize outcomes with use of penile traction therapy and specifically the RestoreX device for men with Peyronies disease. Now, although the RestoreX device won't work in all men, there are several common errors I see patients make that reduce efficacy. Also, there are some things you can do to make applying traction much easier and more comfortable. Now, the goal of this video is to review some of these steps, and I'll review each of these one at a time so you can jump ahead to the area that's most applicable to you in your situation. The current video will discuss applying sufficient traction correctly, making sure that traction is occurring to the penis itself rather than the penile skin, and methods for applying counterbending forces to assure that traction is applied to the area of curvature. Now first, applying sufficient traction correctly. Often patients struggle with the concept of advancing the device to maintain traction. Now in general, if you can see the white line shown here, while the device is on, it means that you're not achieving enough traction. Now while you're doing straight traction, ideally, you want to nearly completely bury the rods so that you can barely see them at all. When you're doing curved traction, in contrast, it's acceptable to have more of the black showing. Now if more traction is needed, such as if you're seeing too much of the black rods, or in particular if you can see the white line, then you need to do the following actions. First, disengage the springs by applying pressure to the clamp and pushing it into the body. Once the tension's been released, advance the whole unit by using your fingers to push the main unit away from the base ring. Now we're attempting to demonstrate this in several different views, but you can see that you can essentially use your thumb almost like a wedge to drive between the base ring and the main part of the device. Now once you've advanced a few clicks, you can re-engage the springs by activating the spring mechanism. This is done by pushing the unit toward the body. Number 2, applying traction to the penis itself rather than to penile skin. Now, one of the most common errors that I see is that people will unknowingly be applying traction to the penile skin rather than the penis itself. Now, this is probably the most common thing we find in men who report that they don't see any improvement in restoring lost length with Peyronies disease. Now this occurs because when the device is placed, the skin pulls tight and prevents it from delivering the traction to the penis itself. Instead, it's applying the traction to the penile skin, which is not the goal. This incorrect use can also result in penile pain, and it most often occurs on the underside of the penis. Now to prevent this from occurring, simply run a finger around the inside of the base ring, as shown here, to free up any areas that you feel may be tight. Also, you can continually reposition the base ring against the pelvis to make sure that as much traction as possible is directed to the penis rather than the other structures. This also often occurs when applying counter traction, and we'll talk about that more in just a minute. Number 3, difficulty achieving counterbending. Well, many patients struggle at first to achieve counterbending necessary to correct curvature. In our experience, we found that it's necessary to get to position 3 or 4, or in other words, to 90 or 120 degrees in order to experience improvements in curvature. Now often this is going to take a little experience and may even take 1 to 2 weeks before you're able to achieve this. There are also some easy tips and tricks you can do that'll make this step easier. Now one way to make counterbending easier is to start off a stretching session in the straight position for 15 minutes before counterbending. Now this will loosen up the penis and often will provide additional length for the counterbending. Now before starting the counterbending, it's also helpful to release all of the traction on the penis. This is done by sliding the release button to bring the unit back to the body. Now be really careful doing this so as to not accidentally pinch the penile or scrotal skin in this area. Once you have the tension released, you can then counterbend the penis, and as mentioned before, the best results are achieved when you're able to get to the 3rd or 4th position. Now as with straight traction, often the penile skin will get caught either at the base or at the area of bending. This can be prevented by wrapping the area over the bend with gauze, toilet paper, or something similar. This allows the penis to slide more easily, and as mentioned previously, you can still run your fingers around the inside of the base ring to free up any penile or scrotal skin so that the skin itself is not being overly stretched. Again, this is one of the most common causes of pain with counterbending and can be easily improved with just these steps. Now if you find that the penis is simply not long enough to achieve counterbending to the 3rd or 4th position, make sure that the clamp housing is set to the closest position possible. Even if your curve is closer to the base of the penis, it's often more important to achieve counterbending to the 3rd or 4th positions rather than to have the bend over the fulcrum. The goal of the fulcrum is to apply more traction to the side of curvature than the other regions of the penis. It is not essential to have the side of curvature immediately over the curve itself. Now, if after all of these steps you still find you're unable to get to the third or fourth positions, just be patient. Most men will only be able to get to position 1 or 2 during the first few weeks of traction. Once the penis is sufficiently stretched, you should be able to get to position 3 or 4. Well, thank you for joining me in this video on the appropriate use of the RestoreX device. I hope that you'll find it beneficial.